Now, health segment. We're talking to Dr. Bote once again. Doctor, how are you?
I'm good.
How's your weekend?
It was great.
Wonderful. All right, hydrocephalus. We saw the video there. And first off, let's establish what is hydrocephalus.
Hydrocephalus basically comes from two words, hydro and cephalus. Cephal is our term for head.
Okay.
Hydro for water.
Water.
So if you say hydrocephalus, you are talking about water on the brain or in the brain. As we have our brain, the brain has a certain amount of cushioning. It's in the skull. Mm-hmm. It's not like it's tight and tight. If somebody hits your head, the brain shakes. Mm-hmm. It's this fluid which we call cerebrospinal fluid that is surrounding the brain and the spinal cord that cushions the brain against hitting directly against the skull. Right. So this fluid is usually produced constantly and is also being reabsorbed constantly. Mm-hmm. There's exchange between the brain and then the body systems as you excrete things. Now, unfortunately, let's say that in the brain you have, just that in your heart, you have what we call the left ventricle, the right ventricle, blood goes in, pumps out, and then there's a constant circulation. As you have your brain, you have the soft tissue of the brain. You also have certain spaces in the brain, which we also call ventricles. Okay. There are about 4 of them: the lateral ventricles, the third, and then the fourth ventricles. Now, these are open spaces that produce this cerebrospinal fluid. And the brain also has 2 parts: the left hemisphere, the right hemisphere. So we have these ventricles, some on both sides, and they are connected by what we call foramen or ducts. Okay. And then from there, it also comes through it bathes the spinal cord as well, all the way down to your back, to your the lumbar region, and then all the way back. Now, if for any unfortunate circumstance there's overproduction of the cerebrospinal fluid, mm-hmm. or there is difficulty in reabsorbing it, or there is impairment or obstruction to the flow of the cerebrospinal fluid, then what is going to happen is that there's going to be a backlog, a build-up of fluid all the time in the brain.
Right, so they cannot flow. The swelling.
Exactly. So then it's going to cause swelling of the head. For some people, it may not cause that much swelling as compared to a child who, a newborn baby. Right. The pictures are very distressing. I mean, if you see a mother with a child whose head is becoming bigger and bigger, I mean, I've seen some to the case of having head size to a point of like a case 4 or a case 5 football. Wow. I mean, lying down, the child can virtually not sit. If he sits, he'll fall. Yes. So it keeps increasing and increasing, and they have all kinds of other symptoms. So it's a very distressing situation that happens. Unfortunately, it's not well understood, but we know that there may be some obstruction to the flow somewhere, or there may be maybe some infections or some for adults, maybe some tumors or something obstructing something in the flow or the reabsorption and the production, for which will cause increase in the intracranial pressure and increase in the amount of fluid that is supposed to be in the head. Okay. Are there different types of hydrocephalus? Yeah, there are different types. There are some we call the congenital and then the acquired. And also we can somewhat divide it into communicating and non-communicating hydrocephalus. Okay. The congenital one is basically somebody who was born with it. Okay. And it's usually common in kids who are babies who are born premature. Okay. Prematurity is one of the causes for having hydrocephalus. You know that as soon as the embryo is formed, there's cell division, a lot of multiplication division, a lot of things are happening. Neural tube is being formed, and development will be completed probably getting close to the time of birth. Labor. But if somebody should have a baby 20-something weeks or 28 weeks, that means that everything is not yet completed. Underdeveloped. Exactly. Yeah. So these are some of the conditions that would warrant some of these things happening. Sometimes too, it may be because of genetic problems that maybe some people have predisposed certain genetic conditions that cause what we call like Dandy-Walker malformations. The thing is being formed, but there is malformation. People are born with Down syndrome, chromosome abnormalities. These things happen. So in the same way, we have some things like Dandy-Walker malformation, Chiari malformation. These are academic terms. They are malformations that just happen, and then it blocks the channels through which the fluid has to flow. Mm-hmm. So these are some of them. So that you have the congenital hydrocephalus being formed because of some of these malformations, genetic, congenital, and then prematurity are all these. These are all.
So the acquired hydrocephalus?
The acquired hydrocephalus, okay. So you may have a child growing up, and then may have infections, certain kinds of infections, meningitis. Meningitis basically affects the meninges, the meninges of the brain, and then the spinal cord and all that. So meningitis when inflammation heals, there may be fibrosis. There may be a complication of the inflammation. So it may fibrosis may form and may cause narrowing of the channels through which fluid flow.
The ducts.
Right. So we have some apart from maybe meningitis, we have what we call the aqueductal stenosis. Stenosis means narrowing. So it's not sometimes just not a complete block, but even a narrowing would reduce the flow, and that would be a deficit in terms of what is going out and what is being left behind. So these are some of the things. Or somebody may have a brain tumor, a tumor somewhere else, again impinging on the flow impinging on the path of the fluid. That can also cause accumulation of the fluid. Somebody can have strokes or bleeding into the brain, causing a mass effect. Also can cause compression and then obstruct the flow of cerebrospinal fluid. All these things can lead to accumulation of the fluid, and we call it hydrocephalus.
Okay. How's diagnosis done for babies before birth?
For babies before birth, it's interesting. If you have, we do ultrasound and these things as you go through your antenatal. There is something we call microcephaly. Microcephaly. Maybe as you are doing your scan, there's something called estimated fetal weight. Sometimes the scanner will realize that the head of this child is at this gestational age is slightly larger
than maybe the other body parts.
Or it's too small for the gestational age of the child. So we start suspecting, is it a microcephaly? Some people too have what we call cephalomegaly, and cephalomegaly will be different from hydrocephalus. Cephalomegaly will just be basically big head, a head that is bigger than normal. There may be no hydrocephalus.
There's no fluid on the brain.
There's no fluid, but just a large big head. When we're a case, we usually call people like that December head. So you have a December head. The child may just have a big head. Could be from the father, could be from the mother. These are some
we won't blame.
Exactly. So we can detect those things from the scan. Hydrocephalus may also be picked up from ultrasound or CT scan. But usually when the child is born, that is a time that you see the progression. So it says have the head circumference of the child increasing faster than normal. So in terms of with that, you realize that because of the increase in the intracranial pressure, because of the fluid accumulating, this child is always irritable, always crying.
So most of the signs will be physical.
It'll be physical. Always crying, always sleeping. Maybe vomiting because there's compression, nausea, vomiting all the time. And because the child is, when you are born, we have what we call the anterior fontanelle, the posterior. There's this space here.
The little dip.
We call the anterior fontanelle. You have the one at the back to call the smaller one at the back, called the posterior fontanelle. Now, and then the skull. If you see a skull, a dry skull, you can see that they are as if they are sutures. Even the bones have been sewn together. When you are born, these things are not that tight, so they are loose. So that with the accumulation of fluid for the baby, everything keeps opening. It keeps opening up and opening up to the point that when you hit the head of the child with a hydrocephalus, when you knock on the head, it's like a crackpot. We call it the crackpot sign. So you knock on the head just imagine having a pot that has a crack in it. The way it sounds, exactly the same way. So you hit it and it's a crackpot sign. And with the accumulation of this fluid, some of the children, they are always sleepy, drowsy, irritable. Sometimes they have seizures. Sometimes there's all kinds of things. And then we realize that they have the pressure on the brain from the fluid will cause the eye to have challenges. The upper lid would be retracting, and then it pushes the eyeball, the black of the eye, down as if it's sinking below the lower eyelid.
There's an image on the screen at the moment
as if it's sinking below the lower eyelid, like the sun is setting. So we call that the sunset eyes. So they have this classic thing about
and that's all because of the pressure that's been put down on the brain,
because everything is accumulating in the brain.
Okay, let's talk about treatment. When we were looking at the video earlier on, there was mention of operations, a shunt.
Yeah.
Let's talk about treatment. I mean, what besides operations, is there any type of other treatment?
Basically, the standard treatment is to do the shunting. There is an operative thing.
It is an operative.
There's a blockage somewhere. There is miscommunication. So there's a malformation somewhere in the brain. The idea is to do a bypass. So a tube is connected surgically into the brain to other parts of the body where the fluid can be reabsorbed.
Right.
One of the places is to connect from the ventricle into the atrium of the heart.
Okay.
Like the left heart, the right side of the heart, where fluids from all your parts of the body come.
The rest of it comes to, right.
So it's connected there. So we call it the ventriculo-atrial shunt.
Right.
So it bypasses the obstruction, puts the fluid into your heart. It mixes with the blood.
This creates a detour.
That's right.
For the fluids to come
yeah,
down.
It creates a detour. So it gets mixed with the blood, goes through circulation, goes into your kidneys. The water is reabsorbed, or absorbed, and then excreted.
Okay.
Another way is to connect it to the peritoneum. At your abdominal wall, there's a place called the peritoneum. So you have the ventricular peritoneal shunt. It's connected in there. The fluid gets emptied into the peritoneum.
Yeah.
The body absorbs it and then gets excreted again. Sometimes they even put it in the pleural cavity, the lungs. There's a coating around the lungs. There's a cavity there that you can put the shunt there, and then also gets reabsorbed. And then there are other surgeries that can be done.
So when a shunt has been put in and the body's reabsorbing the fluid, does the size of the head reduce again, or is that permanently the case?
Yeah, so if you have for a child, for example, the increase in size was due to the accumulation of the fluid. Now, the quicker the intervention into the surgery, into the problem, the better. So once that is done, then the size will also start reducing, because now there is the flow out is now obtained, so the fluid can flow out. Just that sometimes there may be over draining. There can be under draining and over draining of the fluid.
Okay.
So those are some of the nitty-gritties around the surgery. There can be an over draining or under draining, either of which is not the best. So basically,
just want to let viewers know we're actually showing some of the process on the TV. These are images of a medical procedure, and they are quite graphic, so just bear that in mind when you are watching. So are there any complications that can, you said that you can either have a little bit too much or a little bit less than required of the fluid once a shunt has been placed.
Yeah.
Are there any other side effects or any other risks?
Yeah, I once saw a young man who came to the consulting room, and we were taking the history. He gave his view. I have had a hydrocephalus when I was a child, so as I speak to you, I have a shunt inside of me. I was like, wow. So then I examined him, and it was right through the back. You could feel the plastic tube over there, straight into the heart, and it's working about normal.
Right.
Now, there may be complications with every surgery. Now, this tube that is in there may kink. It's plastic, it may kink, and then that would affect the flow of the fluid. If there's over drainage, it has its complications. If there's poor drainage, then you still will be having the fluid sitting inside there, having all the. If you are an adult or if you've grown older, when your sutures the sutures usually close by 3 years. Spontaneous and suture by 3 years is totally closed. So then now the head cannot expand.
Yeah.
But then you'll be having a lot of headaches, a lot of nausea, and urinary incontinence, because now your body is forced to expel fluid so you can't even continue with the slightest bladder problems. You have to rush and get fluid out. So all these things are complications that may go with having a hydrocephalus. The surgical complications too are there, but the advantages far outweigh the disadvantages of having the surgery. Most of globally would say that maybe 1 out of every 500 children is likely to have a hydrocephalus.
Okay.
We may not be seeing these things coming as many times into the hospital because in our society people stigmatize.
That's what I was going to ask you. What is the rate of actual reporting of such disease? Because typically when we see this in our African culture, we say either it's a curse,
it's a curse, or
the devil, or witches, or
the ghost may be angry and all that, or the mother is this, the grandmother is that, the grandfather is that. But these things are things that happen. In America, they have the ratio of 1:500. Out of every 500 children, one is likely to have a hydrocephalus. hydrocephalus.
Right.
So it also happens here. I mean, if you go to Kolebu Children's Ward, you are likely to see one. What I want to say to the mothers is that it is not anything strange. It's not because of anything you did as a mother. Not because of any the father did or some family member did.
It's not spiritual.
It's not spiritual. These things, they happen. I mean, they are mistakes of nature. I mean, we are all born. We go through meticulous processes to come out. Something can go wrong. Yeah. Something little can go wrong. Down syndrome, all kinds of syndromes, they happen.
Yeah.
And then it's because of the cell division. Something, instead of 2, it becomes 3.
Yeah.
And even twins, sometimes we think they are mistakes of nature.
Yeah.
Right? Triplets. But some mistakes of nature are good. Some people are born as with extra IQ.
Yeah.
It's also a mistake of nature, but it's a good one.
It's true. Some people have 6 fingers.
Exactly. The mother should be bold and confident to bring the children to the hospital and get treatment. It's not.
Is there any kind of medication that we can be given?
In terms of medication, usually for those who have grown, what we do give them is maybe diuretics. By diuretics, I mean that something that will induce urination quickly.
Okay.
So diuretic to
expel more
fluid at a much faster interval, so that it doesn't accumulate too much. Just like people who may have heart failure, and we give them fluids to clear the lungs of a lot of fluid that is sitting in there. Yeah.
All right, Doc. Thank you so much for coming in this morning and discussing once again with me. This has been our health segment, kindly brought to you by Lipton Tea, inspiration flowing from nature. And this has been Dr. Bote from Ridge Hospital as well. We'll be back in just a few moments here on New Day. Stay with us.